This video will explain how one may get rid of back pain by using a specific test and special exercises. The test checks the functionality of the intervertebral disc. Can the disc move freely in all directions, or is it somehow restricted? 1. The IPEL test. The test starts in this position: shoulder against the wall, hand on the shoulder, hand on the side, legs crossed. Move the hip to the wall. Move the hip forwards along the wall. If this side moves freely without pain, there is no obstruction. Repeat the same procedure with the other shoulder against the wall. On this side, the motion is restricted. Such obstruction may often be treated effectively with special exercises. 2. Therapy. Put yourself in the position where movement is restricted. Move as far as possible. Hold this position firm for 5 seconds. Move back along the wall and relax. Move forward once again and try to reach further. Repeat this procedure 5 to 10 times. When your back starts moving freely, stop the exercise. If it hasn't fully improved, take a 5-minute break and repeat the exercise. Stop if it becomes too painful and when pain radiates down the leg. The exercise is often a bit painful at the end of the range of motion. This is okay. If the test indicates obstructions at both sides, start with the most restricted side. Follow up with the other side. Another option is to exercise with a roll made from a pool noodle. Lie on your back with your knees as shown. Put the roll under the lower part of your back. Relax and lower your buttocks onto the floor as far as possible. Hold for 10 seconds and repeat. If it's not too painful, you may stay in the final position up to 5 minutes. If it's effortless to hit the floor with your buttocks, put a book beneath the roll. The test results and effects of the therapy can be explained by the changes in an intervertebral disc. With a healthy disc, the core content is separated from the rings of fibers, the annulus. The disc can move freely. Core content may leak into the annulus, causing obstruction. The exercises may press the leakage back into the core. A restricted movement with the right shoulder against the wall indicates a leakage in the left back part of the annulus. With this exercise, the disc is stressed both at the left side and the back side. This may push the leakage from the left back side back into the core. With this exercise, the leakage may be pushed from the middle back part of the annulus back into the core. Therapy results. When the pain and stiffness have disappeared, the leakage has been pushed back successfully. When the disc has been damaged substantially, the height of the disc may be lowered. The remaining movements may be too small to be effective. When pain occurs in a leg, a nerve may be pinched, possibly by a herniated disc or by bone growth in the spinal canal. Pain in the leg may also occur if the space between two vertebrae has decreased. Does pain occur in the leg? Stop exercising. Usually, leakage occurs in the back part of the annulus. However, it is possible in the front as well. An arched position of the spine may increase leakage, stiffness, and pain. In contrast, exercising with the spine in a rounded position may reduce such leakages. Put a firm pillow below the buttocks and hold your knees gently. Relax and stay in this position for 5 minutes. The leakage in the front part of the annulus may be pushed back into the core. Tips. Tip 1. Vary the distance to the wall and continue in the position that gives the best result. Tip 2. When your back becomes uncomfortable or painful, start with the IPEL test right away. This way, serious damage may be prevented. Tip 3. Walk a lot, preferably 2 times a day at a firm pace for 45 minutes. This is a natural way to press leaked core content back from the annulus into the core. Tip 4. Avoid twisting your back when sleeping. Use a body pillow. This way, the disc can fully recover during the night. Tip 5. Avoid sitting for extended periods, especially slumping. The test and exercises shown in this video may be considered a modification of the Mackenzie therapy. However, the underlying rationale is different. For more information and treatment options, see the book Lower Back Pain, Hernia and Acute Lumbago, How to Get Rid of It.